Hi, I'm Dr. Ron Kurzeka, author of The Total Parent, and today's topic is passing out. Passing out is not a normal occurrence, so any child who does pass out should be evaluated by your doctor as soon as possible. But some things that can cause a child to pass out are simple things like a breath holding spell. A breath holding spell occurs in younger children, 2, 3, 4 years of age, and they sometimes will hold their breath when they're suddenly surprised or shocked or startled, and they will hold their breath and they may actually pass out momentarily from holding their breath. This causes a reduction in their blood pressure, and that causes them to pass out from holding their breath. But usually, just by talking to the parent and identifying what the child was doing at the time, just before they passed out, you can identify that maybe they were surprised or shocked by something, and they kind of held their breath, and then they passed out afterwards. So taking a good history of what happened during the incident is very important. Another thing that can cause a child to pass out would be what's called vasovagal syncope. And that's a big term for a simple problem in which a child passes out because they were frightened or scared by something, and as a result, their blood vessels in their body dilate and their heart rate slows down, and this causes their blood pressure and the blood to their brain to decrease, and so they pass out because of that. So a child who has a fainting episode usually has something that incites it, such as maybe somebody was drawing blood from them in a hospital, or they saw something like somebody who was bleeding from a cut, or they saw themselves bleeding, and it made them feel scared and frightened, and as a result, their blood vessels dilated, their heart rate slowed, and they passed out. So in a case like that, usually they appear to be somewhat sweaty. They may appear to be a little bit pale when that occurs. But again, this is called a vasovagal syncope or vasovagal passing out. The third thing that can cause a child to pass out would be some type of heart irregularity. And normally we wouldn't see this in children, except some children will have an unusual conduction system in their heart, which causes their heart to either slow down excessively or to speed up and beat too quickly. This is called an irregular heartbeat or an arrhythmia. So if your child suddenly develops a very fast or a very slow heartbeat, this may cause their blood pressure to drop, and they may pass out as a result of this. If you know how to check their pulse, that's something that's very good to do if you can count their pulse and find out if it's very slow or very fast. If you don't know how to count their pulse and they suddenly pass out, the best thing to do is to call the ambulance to check the child and put them on a heart monitor, or bring them quickly to the ER if they come to within a brief amount of time. So those are some of the important things that can cause passing out. Number one, a breath holding spell in young children, like 2, 3, 4 years of age. Number two, vasovagal passing out, which is due to something frightening or scary that caused their blood pressure to drop. And the third thing, an irregular heartbeat, very slow or very fast, which caused their blood pressure drop and they passed out. Thank you for watching. My name is Dr. Ron Kurzeka.